Welcome all to the today's session. This session is a small session about clamping of the umbilical cord and placental transfusion. This is a scientific impact paper number 14. It is published in February 2015. Okay. In the SIPs, that is scientific impact paper, there may be one or two SBS from the SIPs. So this is one of the important SIP. Okay. So what is our traditional practice is ICC, that is immediate cord clamping. It is a part of active third stage of the labor, where what we do ICC, give prophylactic uterotonic, and we do CCT, that is control cord traction. So third, traditionally our active management involves ICC, CCT, and prophylactic uterotonic. Okay, so immediate cord clamping, prophylactic uterotonic, and control cord traction to reduce the PPH. Okay, so that was a traditional practice. What is the effect on PPH? The prophylactic uterotonic clearly reduces the major PPH. Timing of the clamping has little impact on the blood loss. So what time you clamp the cord, it will not have impact on the blood loss. You are giving the uterotonic and it is preventing the PPH, and your timing of the clamp will not interfere with the amount of the blood loss. Now please concentrate on the definition. Okay, what is immediate cord clamping? It is within 30 seconds of the birth. Your baby is delivered and you clamp the cord immediately. That is within 30 seconds. It is called as ICC or immediate cord. Then second is a deferred cord clamping. That is clamping of the cord is deferred at least for 2 minutes after the birth. Okay, so this term it is preferred over the delayed cord clamping. Deferred is preferred over the delayed. Okay, it is after 2 minutes. Okay, an intermediate or often unclassified is what is between 30 seconds and 2 minutes, that remains unclassified. Okay, now these particular timings which they have given, this is from the SIP. Okay, here 2 minutes only in the SIP you will get. We will see what are the other timings which are mentioned. Okay, what we have to do, we have to document. The best practice is to record the exact clamping time rather than relying on the arbitrary categories. So always document at what time after the birth you have clamped the cord and document it. Okay, now let us concentrate here. What does the FIGO and WHO says? FIGO and WHO they do not recommend ICC as a standard. WHO advises late clamping between 1 to 3 minutes. Okay, so here we are coming across the time of 1 to 3 minutes unless urgent resuscitation is needed. So when we talk about the delayed cord clamping, it refers to the 1 to 3 minutes as per the WHO. Okay, so as I mentioned, this is a figure from the SIP, scientific impact paper. But what does the WHO says? The delayed cord clamping is 1 to 3 minutes unless resuscitation is required. RCOG says clamp only as early as necessary based on the clinical assessment. So early cord clamping only depending upon the clinical assessment, otherwise delayed. Okay, what does the NICE says now? NICE says avoid clamping in the first 60 seconds unless cord or heart rate concerns are there, and clamp before 5 minutes, but support further delay if the woman wishes. Okay, so generally they ask either WHO or with respect to NICE, but it is never before 60 seconds. Okay, so 1 to 3 minutes you can remember, and NICE says not before 60 seconds, and clamp before 5 minutes, but support the patient's wishes also. Okay, so you will be able to remember these values. Okay, then what is the physiology of placental transfusion? What is the amount of the volume which is transferred? The term baby receives around 80 to 100 ml extra blood after the birth. So when you do the delayed cord clamping, the baby will receive around 80 to 100 ml of the blood. Okay, blood volume rises from 65 to 75 ml per kg to 90 ml per kg by this. Okay, effect of immediate clamping. What happens if you clamp immediately? It reduces the blood volume by 20 to 35%, depriving the baby of 20 to 30 milligrams of iron, which is enough for 3 months. So the baby is deprived of this much of iron. Generally, it lasts for 3 months. Okay, this particular story. Then what happens in preterm babies? It may lose a proportionately greater blood and red cell volume. Physiology less, it is less understood about the preterms. Okay, then circulatory transition at birth. What happens? The umbilical flow slows down, the pulmonary resistance will fall down, and pulmonary flow rises. Okay, So these are the physiological changes which are happening, and cord flow may aid this transition. Risk of immediate clamping, it may impair the transition, and especially in preterm or compromising. So whatever these changes, what happens, the umbilical flow reduces, the pulmonary flow increases because the pulmonary resistance decreases, and if you clamp this immediately, it may compromise this particular transition. Okay, so that is why immediate clamping is not advisable. Benefits of delaying are increases, it increases the blood volume. Longer delay may improve cardiorespiratory stability and blood pressure without further volume changes. Okay, that is why the delay is suggested. Now, this particular what exactly the immediate is, here they have mentioned 15 seconds, or previously we have seen 30 seconds. In preterm they say 5 to 20. We will not go into too much details of this. Generally SIP has got many figures, but as SIP are very less commonly asked. I'm just going to discuss the important points from this SIP. We'll skip this. What is the conclusion between the term and preterm? Deferred clamping in healthy term infants is beneficial for iron stores and safe if phototherapy is available, because once you do the delayed cord clamping, more amount of blood goes to the baby, and there is some risk of the need for the phototherapy. Okay, so jaundice requiring phototherapy, lower risk with it, immediate cord clamping, that is expected. If you do the immediate cord clamping, jaundice risk will be less. Okay, so this is the point. Now, what are the factors influencing the placental transfusion? Prophylactic uterotonic drugs, they will reduce the PPH risk but do not alter the final transfusion volume, but affect the speed and duration of the flow. But the final transfusion volume is not getting affected. They will affect the amount and speed of the flow. Okay, now these questions they can ask you, especially IV ergometrin. It has got a rapid uterine contraction, so transfusion is complete by 1 minute. So but we are not recommended IV ergometrin at all. So what is recommended is IM oxytocin. IM oxytocin will act over a period of 2.5 minutes. IM ergometrin will act over a period of 7 minutes, and the placental transfusion is generally complete by 1 minute. So these particular medications will not interfere with the placental transfusion. Okay, so whatever the prophylactic uterotonic you are giving, either oxytocin or IM ergometrin, this will not affect the placental transfusion. Okay, because the placental transfusion is completed by 2 minutes. Okay, so this is one of the concepts which you should learn from this. Okay, now what about the gravity? What happens when you keep the baby below the level of the placenta? At that particular time, obviously the gravity will increase the blood flow. If you like a cesarean section, you will lift the baby more than 20 centimeter above, it will reduce the blood flow. But what does the guideline say? Venous flow to the baby is gravity sensitive and arterial flow is less sensitive. Okay, raising the baby above the placenta reduces the venous flow to the baby, possibly reverse flow. Okay, so when you raise the baby above the placenta, it reduces the venous flow. Lowering the baby below the placenta increases the flow to the baby, but no major net volume change, but it does not change the much volume. Without uterotonics, effect is more pronounced if the baby is catched up or the held more than 20 centimeter above or below the introitus. So if you do not use the uterotonics, then only there will be some change. But with oxytocin at term vaginal birth, placing the baby on the mother's abdomen or chest do not have any impact. So what happens? What is recommended when you do the delayed cord clamping? We place the baby on the mother's abdomen or the chest, and that even if it is above the level of the placenta, it does not have any impact on the placental transfusion. Okay, so we have seen about the uterotonics also, and we have seen about the position of the baby also. So it does not have any effect on the placental transfusion. So these were the couple of points which or concepts from this SIP you should remember. So historical practice is immediate cord clamping was part of active management. Uterotonics will reduce the PPH, but optimal clamping timing needs reconsideration. Preterms, what happens? Immediate clamping will increase the intraventricular hemorrhages risk, and mechanism will include hypovolemia or BP fluctuations and requires urgent RCT evaluation. Okay, stabilization with the cord intact. Drying, keeping the warm before separation is possible, and baby position near the uterus level acceptable to staff and valued by parents, and enables completion of the placental transfusion. So even if you keep the baby on the abdomen, generally there is no problem. Regarding the iron stores, what does the SIP say? Immediate clamping linked to lower iron stores for 3 to 6 months. That is why immediate cord clamping is not suggested. Long-term neurodevelopmental effects unknown, but should be studied. Iron deficiency in early life may cause irreversible delay. Then term births, differing the cord clamping improves the infant iron stores, may increase the jaundice risk, but benefit outweighs the risk if phototherapy is available. So that is why in term infants, what we suggest is deferred cord clamping. It will improve the iron stores, may increase the mild jaundice risk is increased. However, phototherapy if available, that can be acceptable. Position, this we have discussed. Uterotonics, we have discussed, no effect. Position also no effect. Preterm birth, evidence is less clear. So these are the different concepts from the SIP. So that finishes our scientific impact paper on the clamping of the cord. Thank you.